The Tamale Central Hospital, now the Northern Regional Hospital, is the second largest referral hospital in the Northern region. The hospital receives between 200 and 300 patients at the outpatient department each day and conduct close to 2,000 surgeries a year. To help improve quality healthcare, JICA came in 2016 with a grant to construct a new facility for the hospital. The government of Ghana's part in the project was to demolish the old structures for work to begin, but government failed to honor their commitment, forcing hospital authorities to seek for support from elsewhere. Behind me is the site where the construction would take place. The government of Ghana was supposed to have cleared this portion before October last year for work to begin. The government failed to do that, forcing the MP for Tamale North, Alhassan Suhini, whose door was knocked on, to demolish the structures and make way for the construction. The project has hit several snags, reducing its original size to now 11 buildings. Even with what is left of the project, there are still challenges. Medical Director of the hospital, Dr. Bashiru Abdul Majid, throws light on the challenges.
The project is infrastructure improvement for the Northern Regional Hospital, which is supposed to be a grant by JICA. It was supposed to start in October last year, because of which we had to demolish some structures of the hospital, including the children's block. Unfortunately, it has not started. It's 7 months behind schedule, and we really don't know when it is going to start.
What is holding the project now?
Information we are gathering is that the JICA wants a tax waiver from government, which is not forthcoming, and that is what is holding them from starting the project.
Dr. Abdul Majid highlights how management has improvised to be able to take care of patients in the absence of the demolished structures.
We were already struggling for space before we had to demolish the children's ward to pave way for the construction. We were already struggling for space, and demolishing this children's block has really compounded the situation. The children have now been moved to the female ward. Females have been moved to male ward. Male wards are now occupying the emergency ward. And so the emergency have been shifted to our triage area, which is just a few beds. And so managing emergency has become a little difficult.
This is currently where the children's ward is being housed. The original building could contain 40 children at a time, but here they have just 26 beds. A senior nursing officer at the pediatric unit, Amidu Smaila, said they have had to deal with congestion in just a limited space.
Really hampering the quality of care you are supposed to render to the children in the ward, in the sense that we are a little bit congested. Looking at the previous ward, it was quite spacious, which could accommodate the number you mentioned earlier, that is the 40 children. But now it's 26, and the cots and the beds are being crowded, and it's affecting free movement of the care we are supposed to deliver to the kids.
Senior staff nurse at the female ward, Mabruka Inusa, said the congestion does not only pose a risk to the patient, but also takes away the privacy the patients need.
It's a lot. As you can see here, you see how the ward is full. You see that the ward is full. There is no privacy. And ideally, we are supposed to have a limited number in the ward. Even in the veranda, we admit patients there, which is not the best.